everybody thinks that when you get sick, your insurance is going to cover everything, and we know that's not true. And with the advent of high deductible plans, it's even a little more important to know exactly what you've purchased and what your out-of-pocket expenses are as you're deciding on which plan to pick, so that you're sure you can afford to pay your co-pays and deductibles and meet your out-of-pocket expenses.
They're a very large concern about the cost of care for the clients that we get the privilege of serving. Typically, the barriers that they mainly deal with is, do I eat or do I pay for my medical bills? I hear that a lot. Or do I pay my utility bill or buy this prescription?
Sometimes when you're talking to patients who are on a limited or fixed income, it kind of comes, do I get it or do I not? And then having that hard decision, do I go with a profound therapy or do I go with a regular standard therapy that my doctor is suggesting here? And so you're kind of thinking, should there be a price on life? So then it kind of comes in where our expertise, our case management services help to do the more appeals part to the insurance company, giving them the data, giving them the information they need, and actually getting the insurances to change their mind and the view, and getting the test approved for the patient.
Typically the first thing patients want to know, can I afford this treatment? You know, and if it's a late stage cancer, I've even had patients say, I don't want to leave this burden on my family. And no one should ever have to make that decision. That's just not a fair decision to make. They should talk to them, be honest at the very beginning, you know, and let them know if there's a payment plan, if there's financial assistance, financial counsel should be available. Many facilities, they do have them available, to let them know if there's any type of charities that can help them up front. That way it can help put their minds at ease and they can concentrate on the main thing, and that's getting better.
One of the things we often find is that people are kind of embarrassed if they're not able to afford their care, and they don't want the doctor not to treat them, so they just go along with everything and don't really ask for the cost or try to figure out how they're going to pay for it, and they just don't talk to the medical team about what it is they need to be doing to make sure that they can afford whatever the treatment is that's being recommended.
In regards to advocating for the patient and what questions they should be asking, if a patient is coming in diagnosed with a specific disease category, what our team and what our case managers and myself as well, what we normally try to ask, has your doctor talked to you about this? Has your doctor talked to you about a clinical trial? Has your doctor talked about any other testings that should have been done?
Really does involve talking to your providers, being honest and upfront, and making a list of questions before you go to the doctor's office. We actually have publications, and a lot of our publications strive to do that, is to actually put down some of those questions that when you're starting treatment, that these are the kind of things you need to know.